Here's how chiropractic care can help with breastfeeding and latching. Breastfeeding doesn't always come naturally to a baby, and it's nothing that mom or baby have done. Sometimes they just need a little extra help with being able to create that latch to be able to feed with ease. First, we would start by checking neck range of motion and any muscle tension in the neck. The reason we do this is because we want baby's head to be able to fall past midline on its own, and with that, we are able to see that they are able to get themselves into a good position to be able to feed on each breast the same. When we find restriction and muscle tension in the neck, that does not allow baby to turn head side to side each way, and therefore that creates a preference for them on only wanting to feed on one side. From there, we check for tight or tethered oral tissues and tongue range of motion. In checking for tight or tethered tissues, we first want to check that the top lip can reach the nose easily. And by that we mean we want the tissue that connects the lip to the gums to remain nice and pink when we lift it to the nose. When we see that there are tight or tethered tissues, that typically leads to a shallow latch. When baby has a shallow latch, they tend to create a pattern of recruiting the wrong muscles for creating that suck. When we see that they are not using the right muscles, that may lead to an irregular feeding pattern, chomping at the breast, or a weak suck. From there, we will do palate stimulation. Palate stimulation helps us to help baby learn to recruit the right muscles to be able to create the latch, suck, swallow, and breathe so they are able to feed with ease. In doing that, we do a nice gentle sweeping pattern at the roof of their mouth to help them stimulate the suck reflex and retrain the necessary muscles that are needed for feeding. Lastly, we will check for palate height. In checking that, we sweep the roof of the mouth to see how high the arch goes. In the first few months, babies' heads are very malleable. So with some soft palate work and cranial work, we're able to help shift those cranial bones back to where they need to be to help to lower that arch and give baby a good airway. If you see that your baby is following any of these feeding patterns or having any trouble with feeding or latching, give us a call and we can help you out.